Do I need a risk assessment for falling? An answer for AGERs. Hello, and welcome to Agerville, my hometown, where AGERs live longer than average and sometimes a decade or more. Today, we're going to examine the need for a risk assessment to prevent falling. What is it, and do you need one? Let's find out. 1 in 4 adults over 65 experience a fall each year, many with varying degrees of injuries, even death. In fact, the Center for Disease Control, CDC, reports that every 20 minutes someone dies from a fall in the United States. It's very alarming. The CDC recommends a fall assessment for anyone 65 or older each year. This video is designed to provide you with information about the falling assessment and screening process, not discussion about whether or not you need one. When it comes to health decisions for AGERs, I leave that to you and your physical health advisors. I educate about health matters, but don't advise or recommend specific treatments or actions. I know my limits. Before we get into details of a risk assessment, I want to talk briefly about preventive measures. The CDC has a program called STEADI, S-T-E-A-D-I, the acronym, which stands for Stopping Elderly Accidents, Deaths, and Injuries. Among other elements, it has an assessment tool for measuring the probability of sustaining an injury. There are also many resources for professionals and caregivers to help with falling prevention. Now, for the basic components of a falling risk assessment. Dr. David Weber at the Mayo Clinic provides an excellent overview of a typical risk assessment for falling. As Dodeke dude who is 10-centered, I especially like it because it uses the measurement 10 in evaluating patients who might need further help beyond initial screening. Those who take more than 10 seconds to do the following exercises or who can't balance for more than 10 seconds are considered at risk for failing or for falling. The assessment includes the following. 5 times sit to stand test. You'll be seated in an armless chair and asked to stand up and sit down 5 times as quickly as possible. The time will be recorded. A single leg stand test. This test will assess your balance. You'll stand on one leg with arms crossed. You'll be timed as you remain in this position without needing to use the suspended leg or arms for balance. Time up and go test. This is a test of your gait or walking skill. You'll be asked to stand and walk 3 meters or yards and return to your seat as you're timed. As indicated above, your performance will be analyzed during a 10-second period, and observational data will also be used in measuring your success with the tasks. You may be tempted to conduct these tests on yourself at home. That could add to your risk of falling if you're unsteady or have poor balance. In that case, be very cautious and have someone assist you. A follow-up to these tests for those who had difficulties would be Treatment by either a physical therapist, PT, or occupational therapist, OT. The PT would help you with gait or walking, strength exercises, balance training, safety information, and practice in getting in and out of a chair. The OT would assist with daily living activities involving balance, coping with visual, spatial, or cognitive impairments, and home safety modifications as well. There may not be a need for a risk assessment if you haven't had a problem with falling or you're confident in your balance and stability. However, if you've fallen in the recent past, I would highly recommend getting one. It might save your life. You should discuss these issues with your primary care physician. Of course, not every risk assessment would be identical to the one at the Mayo Clinic, but these are likely interventions. Check with your healthcare provider to see what they have to offer. Humpty here, wishing you a day of good balance and safe living. Check out some of my other videos on these topics and see the links below for additional information.